So hey guys, we had just did the lactose metabolism, right? And then we figured it out, the galactosemia also. Now in this, I'll be discussing about the sucrose one, okay? So I'm gonna share you my screen first. So in case I don't forget my notebook, okay? And then click share. I hope you can see my screen now, okay? So this is what we have done in the previous video, right? And quickly, I'll make a short video for the sucrose one also, right? You can say the sucrose. Why I'm writing both the name of the disaccharide as well as the monosaccharide, because sometimes there is so much to learn. We tend to get confused between the names. Right, sucrose is a disaccharide, fructose is a monosaccharide, right? And again, imagine divide the page into two half, right? And for the pathway, use the left wala side, and for the other clinical correlated or any other information, use the right wala side. Use a smaller font size. I'm going to use bigger so that it is visible to all of you, right? So sucrose is here, like from the intestine, you have absorbed the sucrose, right? In the diet, in the intestine, you should be keeping in the mind whenever you are doing the metabolism, which organ now you are in. That is going to help you a lot to remember the location of the enzymes and from where the enzyme deficiency is coming from, right? That is going to like sort out lots of problem for you guys, okay? So where we are in the intestine, right, sucrose is being absorbed, right? And then it is being cleaved into its monosaccharide. Sucrose is made up of glucose plus the fructose, right? And what is the enzyme? Enzyme is sucrase, right? But there are some fruits, juices, sugar, honey, right, from where you can directly get the fructose from the diet, okay? So this is the another way you can get the, you can say high fructose syrup containing juices that we have in day-to-day life, directly add on to the fructose, right? Now this fructose, again, the same thing via your blood, right, via the lumen of your blood, right, will come inside the organ. Which organ we are in? Either in the liver or in the kidney, right? Liver or the kidney, not in the brain. That was in the galactose, not in the brain. We are not talking about that, right? Fructose is there, and we need to trap the baby in, trap our girlfriend it, so she does not find any other boy, right? So we are going to phosphorylate to fructose 1-phosphate, and that enzyme again is a kinase enzyme. Kinase enzyme. And what kind of a kinase? Is it a glucokinase? No, gluco is for glucose. Galactokinase is for galactose. Here this is fructokinase. Here it is fructokinase. Remember, there is this housekeeping enzyme, hexokinase. Hexokinase is a housekeeping enzyme that works with any kind of a hexose, be it a galactose or a glucose or a fructose. सबके साथ वो काम करते हैं. Even mannose also it works with. ठीक है? So fructose, and it is found in everywhere also, the hexokinase. So fructose 1-phosphate is there, and that will be cleaved. What do we see in the glycolysis cycle? Glycolysis cycle may, when we had the fructose wala entity, it got cleaved. The fructose 6-phosphate got cleaved into DHAP and glyceraldehyde 3-phosphate. So here abhi kya hai? Only 1-phosphate is there, but that time we saw the bisphosphate, 2 phosphates were there. So dihydroxyacetone phosphate will get the phosphate, and then we will be left with glyceraldehyde only. Okay, no phosphate. We have to phosphorylate it, right? And that phosphorylation is done by another kind of enzyme, right? Hexose, triose, or some kind of an enzyme to give you glyceraldehyde 3-phosphate. Right, and both of these, DHAP and D3P, right, they can go either in the glycolysis, gluconeogenesis, right, and glycogenesis also. Glycogenesis also. Why I'm saying glycogenesis? Because if you have high fructose, there is lots of glyceraldehyde 3-phosphate available, then it can be stored in the body, right? It can be stored in the body. So this is overall structure, right? And now coming back to the enzyme, the cleavage is done by the same aldolase enzyme, but this time this is aldolase B, right? This aldolase B. How do I remember this? Now we are talking about the clinical correlates. I'll tell you how we are going to remember where is aldolase A and where is aldolase B. Okay, sucrase, right, is the one which gives you the glucose and the fructose, right? And then the fructokinase deficiency, right? The fructokinase deficiency, if we talk about deficiency, fructokinase deficiency is benign, right? And like usually we don't check it, but accidentally if we have checked the urine for some other disease, the dipstick method test its confirmation that there is fructose in the urine, and what is the removal, or you can say diet correction is the better word. Diet correction is the better word to deal with the fructokinase deficiency. Important is aldolase B. If this is deficient, then patients suffer from fructose intolerance, hereditary fructose intolerance. Fructose intolerance, like the lactose intolerance, this is fructose intolerance. Sometimes you may see it with the name hereditary fructose intolerance. I remember it with the name FBI, right? F is for fructose, I is for intolerance, and B is for aldolase B. That is how I remember fructose intolerance mein bhaiya aldolase B is the one who's going to be deficient, right? That is my trick. Let me check if the screen is being shared. Yes, screen is being shared with you. I'm glad. Okay, so this is hereditary fructose intolerance, or you can say aldolase B deficiency, right? And what you will see in the question, lethargy. Patient is having the clinical aspects are the lethargy, same as the galactose or lactose wala, vomiting also, diarrhea also, hyperbilirubinemia also, hyperbilirubinemia bhi likha hoga, right? Just write it down. Then what we will see is hypoglycemia. Remember this, guys. You see hypoglycemia in the fructose intolerance. You don't see hypoglycemia when there is galactose deficiency, like enzyme is deficient. So this is a key feature. Both of this presentation looks very similar, only minute differences there. One is the hypoglycemia. Okay, let me grab my pen. What else we see? Lactic acidosis. Hypoglycemia hai, fir bhi lactic acidosis hai, right? And a renal, proximal tubule defect. Actually, I have a piece of a paper in front of me so that I don't forget when I am teaching you. Sometimes we keep forgetting a very few, like important points. Okay, so this is the hereditary fructose intolerance you should be knowing about, FBI, aldolase B, and these are the clinical correlate. In the question paper, you will see the hypoglycemia, but you will see the hypoglycemia and what kind of a cataract it will be related to, right? Usually fructose, they will say, is not related to cataract, and that is true. But there is a polyol pathway, right, that we will be discussing next also, that somehow tells us there is a snowflake cataract, which is actually because of the sorbitol. Sorbitol in the eye causes snowflake cataract. Right? If fructose can be converted into sorbitol, see, fructose is not related to cataract in a sense. This is not an aldol. right? It is not an aldol, right? And aldol reductase is the one which is making an galactitol kind of a thing or sorbitol kind of a thing, right? So it is a kind of a confusion part, but let me clear this thing out. Right, just let me tell you right now, then we can finish with the previous one. So there is this, wherever you have space on the piece of a paper, write out polyol pathway. Polyol pathway, right? Polyol pathway is the one for the ols, right? Ols means alcohols, right? Where the aldol reductase reduces them. Reduces, right? Aldol se remember karo, aldehyde, O say alcohol, right? Aldehydes are being converted into O's that are going to cause the cataract, right? And usually, but where do we see? In severe cases of diabetes mellitus with hypoglycemic condition. Sugar, glucose is there, but it is not being used. So this glucose is converted into sorbitol. And who converts it in sorbitol? Aldol reductase, because it works with the aldehyde. Glucose is an aldehyde, but here we are talking about fructose. Fructose is not an aldehyde. It is not converted into sorbitol by aldol reductase. Okay, so it is not related to polyol pathway, but there is sorbitol. There is this enzyme sorbitol dehydrogenase. Dehydrogenase, which converts fructose into sorbitol. Okay, so then you can see in exam a question with snowflake cataract, or you can write a short note, okay? Snowflake cataract, if they ask you about the polyol pathway, right? Snowflake cataract is there, right? Hypoglycemic condition is there, or patient is suffering from diabetes mellitus, right? Aldol reductase in the lens converts glucose into the sorbitol, causing snowflake cataract. You can add on this to any of the question that is related to maybe the glucose, if you have to fill in like 10-12 pages. So you can add this, squeeze in the polyol pathway, right? You have to just fill in the pages and give them more information to the teacher, but towards the NEET PG, because these notes you are going to use in the like for the NEET PG preparation. Then what you will see is the snowflake cataract, right? That is because of the sorbitol accumulation in the eye, which is osmotically active component, right? It is gonna suck in the water from the nearby cells, right? And causing the like retina to swell up and leading to the snowflake cataract, right? Similar to what we have learned in the galactitol. Galactitol was from the galactose. These both are aldols, right? And that is why aldol reductase work on them. But the fructose is converted into sorbitol by sorbitol dehydrogenase. And whenever these kind of reactions are going on, you can write it down NAD. NAD means NADPH is being one kind of an reducing power is being used, that is NADH or NADPH, right? So here is NADPH by aldol reductase, whereas sorbitol dehydrogenase utilizes NADH. If the question paper would be very, very difficult after 5 years, right? After when you'll be taking the NEET PG exam. I guess this is pretty much it about this. Let me see if I forget anything. Let me quickly take a look. Right. There is one more thing. You should be writing it down here. Whenever you will see the question, let's say they don't give you the simple question, right, directly about the fructose or fructose intolerance, right? They give you a clinical case scenario. So, right, what you will see a 4-month-old baby. Now, not the 4-week-old baby, but the 4-month-old baby, right? Who is under like weaning off, right? He has left the breastfeeding or on the table food. और किस पे है? Table food पे है वो. ठीक है? Table food means probably the juices or any snacks is contains lots of fructose, right? And same things you will see the yellow skin, that you have seen with the galactose. Yellow skin bhi hogi, lethargy will be there, vomiting will be there, right? But these are the things you are gonna look for. 4-month-old, weaned off position, right? And then we will correct the diet. That will be sucrose or fructose free diet we are gonna give to the baby. So these are the notes, right, or the chart for your sucrose fructose metabolism. As you will study along, you may encounter maybe 2-3 few points, right? How about the regulation of the enzymes? Probably, I don't think there is much more to it, but still you're gonna write it down in here with a different color pen, or you are going to put a sticky note to it. See, I make use of the sticky notes. You can have these kind of a sticky notes, right? I have plenty of them. So whenever I have something, I'll write it and I'll stick on this piece of a paper so that I have extra information related to that also. Okay. So with this, I'll stop this video, right?